Good evening, everyone. Welcome to the Black Doctoral Network weekly web series entitled Conversation Starters. I am your moderator, Fesse Elonge, and I am thrilled to present to you this evening's topic entitled Changes to the Academic Landscape During a Pandemic. I am excited that we have some expert scholars that will provide their perspectives and insights to really understanding the types of changes that have occurred in the academic setting due to the current pandemic we're experiencing. So I want to go ahead and jump right in. Our first panelist joining us is Dr. Keith Hargrove, who is currently the Dean of the College of Engineering at Tennessee State University. He received his PhD in Industrial and Manufacturing Engineering from the University of Iowa as a CIC Fellow. His current research interests entail promoting STEM education in K through 12 and minority faculty in higher education. I welcome you this evening, Dr. Keith Hargrove.
Thank you so much. Thanks for having me.
Okay, thank you. Our next panelist joining us is Dr. Felicia Bowen, who is currently the Associate Professor and Assistant Dean for undergraduate programs at the Medical University of South Carolina College of Nursing. She has her DNP from Fairleigh Dickinson University, a PhD from Columbia University, and her research interests entail improving health conditions for underserved children and families. I welcome you, Dr. Felicia Bowen.
Thank you for having me.
Wonderful. And our third panelist joining us this evening is Dr. Malika Jeffries-L, who is currently the Associate Dean for Graduate School in Arts and Sciences and Associate Professor of Chemistry at Boston University. She has her PhD in chemistry from George Washington University, and her research interests entail development of organic semiconductors, materials that combine the processing properties of polymers with electronic properties of semiconductors. I welcome you, Dr. Malika Jeffries-L. Wonderful. So I wanted to go ahead and jump right in. As you know, the pandemic has been something that has affected a lot of sectors within the United States and as globally as well. And we really want to dive into understanding how the various changes and the pandemic has affected the academic setting. So the first question that I have for you all is, how would you describe the impact of the current pandemic on the academic landscape? I'll go ahead and start with Dr. Bowen.
Yeah, I think this pandemic has definitely elucidated the inequities at all levels of education, from primary school through the collegiate level. So, vulnerable populations are definitely suffering. And where we saw, or where there were cracks before and people didn't want to see, this pandemic has really shone a light on it. At the collegiate level, we are finding it difficult in terms of having to tighten our budgets. So, operating, having to do the same amount of work on tight budgets, and especially for state institutions where states have been hit hard, caring for people with COVID, those are less dollars that can come into schools. And then, in the primary and secondary area, just the disruption that has been caused from children having to leave school, being taught at home, the inequities that are being created by children being educated at home. So it concerns me. I think that not only are we going to see things, they're difficult at the collegiate level, but I'm worried about those young ones that are going to come up. Are they going to be ready for college because of the pandemic?
Thank you for those points. Definitely, that is a big concern of the future generations' preparation for future endeavors in an academic setting. Dr. Hargrove, what are your thoughts?
Yeah, thank you again for inviting me. So, when I think of higher ed, if you ask a lot of presidents of higher education institutions, what are their primary concerns? I think they would generally say the three C's. One would be cost. The other would be completion, getting students to actually graduate from their programs. And then obviously the next C would be COVID. And the impact of COVID-19 on higher ed and the word used, disruptive, is the right term, because it has impacted primarily how we deliver content and knowledge to our students. And quite frankly, it has transformed higher ed in terms of delivery. In addition to that, with a kind of a different pedagogy that many universities have had to develop and transform and prepare beyond the University of Phoenix and the traditional online education. How does these institutions do that and have an impact or not have a deficit in the quality of learning that takes place as well? So, and then on top of that, I would also add, I did a survey of students, and one of the things that came back, as many of you would probably know, the anxiety level and stressors that students are confronted with has been somewhat really difficult from them from a mental standpoint. And pile that on with trying to study engineering or chemistry or practically any major does create a challenge for students. So, there are a lot of things that are piled on that. And so we as university administrators, faculty, we certainly going to have to be more innovative and more creative in addressing the concerns of the students, making sure that faculty have the tools and necessary to deliver the content and knowledge as well, and also manage the impact of costs that COVID has done on higher education institutions.
Okay, thank you. As you mentioned, it's very important to highlight the psychological impact of this pandemic. Thank you for doing that. Dr. Jeffries L., what are your thoughts?
I echo a lot of what's been said, but I will add to the mix is one thing that this has highlighted strongly is the social inequities that exist, both inside college campuses and outside. Many colleges had to grapple with the reality of, distance learning, and they say, okay, well, we'll go remote. And aside from all the complications in terms of delivering the content, you can't overlook the fact that sending a child home to learn or sending a college kid home to learn is going to be a very different experience for everyone. As a student who has maybe works hard, we had so many students who have, against all kinds of odds, managed to go to top universities throughout the United States, mostly on scholarship, and to strip away the comfort and the environment that would provide and the fertile learning ground that was, to say, now go back to your overcrowded apartment with your family, and we expect you to deliver the same quality of work as your peers who may have gone back home to more comfortable homes. We have students who are dealing with housing instability, food insecurity, and college was the sanctuary. College was where the playing ground was leveled, and now we've made an uneven playing ground again if we send the students home. And for campuses that were able to open back up, that's great that for the most part we resolved that issue. My work function is on the graduate side of the house, and then the secondary issues that come from that is, again, financial instability. A lot of graduate students are scratching by on shoestring budgets, often augmented with secondary jobs that were in service sectors that also were now closed as a result of the pandemic. And so we started to see tremendous financial issues with our various graduate students as well. And another complication that came up is the fact that education in the United States is really an international enterprise, and that a number of our students come from abroad. And so as many countries close their borders, and even as we closed our borders, or some places closed their borders specifically to the United States because COVID is running unchecked, it caused a huge issue for many students who had sought to come to the United States to study, to only find that they were not able to get here this year, and the disappointment that it presented to those students. But then in terms of the cascade effect on the whole enterprise, international students are a huge revenue arm for many universities. And so those students couldn't get here. Tuition dollars aren't here. And then the whole thing spirals in terms of what you may have planned to do for your other campus resources based on income that was also forfeited. So it's multifaceted, and it's a very complex situation. But I think there's not one part of the campus that wasn't impacted by this in some way, shape, or form.
No, definitely. I agree with you all. And I see the consensus is that there's a lot of factors and a lot of areas that have been affected. And as you mentioned, the inequalities that have come to the forefront due to this pandemic. So with all this that we already currently know, the next question that I have is how important is academic leadership in effectively managing these adverse effects of the current pandemic? I'll start with Dr. Hargrove.
So, presidents and academic leaders were in a very challenging position because trying to make a decision about bringing students to campus, the risk involved for them, as well as the employees or faculty of the institution, that was a tough decision in the fall. And, a majority of institutions decided to make that call and bring students to campus. But as we've seen, breakout has happened at a lot of campuses. And so some are questioning, was it the right thing to do? Well, most surveys will say the majority, I think at the last survey I saw, 75% to 80% of students actually wanted to come back to campus in the fall. And a lot of it is because my colleague had expressed that because it was somewhat of a sanctuary in order to learn. However, from a leadership standpoint, we as the president and the president's cabinet and deans and chairs and faculty, we all play a leadership role in the health and the well-being of our students. And many institutions have gone to virtual and remote, but there are some institutions where students have actually returned back home. So certainly it plays a key role. Quite frankly, it was a tough call to do that. Some would argue that students were brought to campus primarily because it was a monetary reason. That's possibly could be. But again, I would say that for the most part, all presidents and leadership put the health and well-being of their students first. And therefore, as you've seen, all campuses have implemented very stringent protocols in order to, in terms of the health of those students.
No, thank you for that. And it's important that you all are here and in actually discussing the type of transition programs that you all put in place during this pandemic, so that a lot of our audience members know that when things like this happen, environmental, public health issues, it does take a toll, and a lot of planning goes into trying to make the best decision for all individuals within that institution. Dr. Jeffries L., what are your thoughts? Oh, I think she may have been disconnected. We'll go ahead and go to Dr. Bowen.
I concur with, everything that Dr. Jeffries has said. I think, the importance of leadership in these situations is having to make those difficult calls. College, universities are businesses, and students are our customers. And, there are expectations. So, yes, parents expect that when they send their students off to school, that they're going to be there for a certain amount of time and graduate. But students are also expecting a certain experience. They want this college experience, what it's like to live in the dorm. And COVID has made that really difficult. So, one of the things that we had to do at MUSC when the pandemic was just starting to ramp up, our students were out. They were out on spring break. And so we had to come together quickly and decide, what are we going to do about this? Are we going to have students back with us? And, we were learning about this disease as it was unfolding. It's a novel disease. It hasn't even been on Earth for a year, maybe a year now that we're in November. And so, we weren't quite sure how it was spread, how contagious it was. But, we had the ability to come together as a team and really brainstorm. And so we're in a school of health, a health professions university. Our provost made the call that all students would not come back to campus after the spring break, and we would continue the year virtually. At my college, our graduate programs are online, but we have an online an in-house undergraduate program. So it took a lot of work working with the faculty to transition a face-to-face program with, almost 300 students on campus virtually. How are we going to teach virtually? And so, there were a few people who had taught in the online arena, but we had to come up with some resources really quickly to get folks trained up, get them at home. And it wasn't just an inconvenience for the students. It's true. A lot of kids or young people are on campuses at college in the dorms because that's the ideal place for them to be. I've been in, for students who've been struggling, one of the things that we've done to be able to help them is to bring them on campus so that they can sleep. They do have, stable places, to live. But now, everything is disrupted. Well, for the faculty, it was equally disruptive. Faculty, many people come into the office because they have little ones at home. They can prepare their lectures, they can get things done. And so all of a sudden we've taken faculty and thrown them back into their homes saying, no, you can't come to your office space, but you're still expected to, teach at the same level, give your exams and adapt. And it was quite difficult. Not only were students negatively impacted, but we had a lot of faculty who were also going through tough times. And so just the mental stress all around for students and faculty was very difficult. We had to find ways to be able to meet the needs of our faculty. And so we were I think, very innovative in finding ways to help faculty come together, maintain that collaboration that they were having, and still be able to de-stress. So it's leadership, I think, has the hard job of looking forward and making the calls that are not really popular, like canceling graduations.
Yeah.
Yes, that was something that was very significantly felt by a lot of individuals planning on, graduating during the onset of the pandemic. So thank you for those very wonderful points. Welcome back, Dr.
Hi.
What are your thoughts in regard to this question?
The good news is I was actually able to keep up on my phone since I know where we are with this when my Wi-Fi dropped out. But yeah, I think strong leadership is going to be so important because there's some very difficult decisions that have to be made, at all levels from the top down. It's balancing the human side of things with what's practical and feasible along with cost. And, everyone in an organization has its job. Obviously, people look to the presidents to figure things out, but really, there's levels to it. The president kind of has a high level systems view of what's going on, but they don't necessarily think or can see the details of the various individuals in the way that the faculty and the department heads and even some of the deans and associate deans have. So I think, communication between those branches is so critical in these times because, people can come up with good ideas and things that make so much sense based on their viewpoint of the equation. But when you get the big picture, you say, oh, and I see the many ways in which now that may or may not work. So it's really important to, not only just have people who come together with good ideas on your leadership organization, but also to effectively communicate between the different arms to to make sure everybody knows what's going on. And, often what we're seeing, somebody spoke to the teaching side of the house, is that certain areas actually quickly were able to pivot and adapt to online training. And it's like, hey, if someone's excelling at this, no reason for everyone else to reinvent the wheel. Like, let's find out. That was some of the conversations that were had on our campus. It's who in your organization, in your department thinks they got this under control, and could they speak to the rest of us and tell us how did they get this under control, instead of everyone trying to figure it out for themselves. And so sharing information, I'm really just enthused by seeing a lot of the activity, even in online communities and virtual communities, where people say, hey, did you guys figure this out on your campus? And even hearing the leadership of various campuses just sharing ideas and best practices, and not being guarded with information, because it's the timing of this is, this was a very rapid pivot. We ourselves at BU, we were on spring break, and then the decision was made to just shut everything down, right on the stage of the break. We're back now. Tough decisions had to be made. We're not having spring break, was an announcement that was made already for next semester, to just run the weeks concurrently and send everybody home early and not risk people leaving and coming back and bringing potentially spreading virus. And so, it's tough. You need strong leadership, and I think you also need to kind of get your mind right for it. I joke with my students and I say, well, this 2020 is the year of disappointment, so let's remember that.
No, thank you.
Yeah, I would also add, I'm sure you guys have seen a lot of the press about these breakouts and, these, whether it's frat parties or gatherings and all of that. One of the big challenges is that when you ask the question for 18 to 22, 23-year-old, are they really going to abide by protocols you set up at your institution when college is all about socialization, right? Mm-hmm. I mean, that's what's so unique about it. It's about socialization. And then to ask an 18 to 22-year-old to abide by certain protocols, when you're young, you don't make the best decisions, right? Mm-hmm. And so we've seen over the last few months that, these breakouts that happen on campus is because of that, irrespective of the leadership putting protocols in place that for the safety of students. So, it's been tough, and tougher for some schools more than others. Mm-hmm. And, I think we all want to do better, and as we get ready to close out the fall and students come home, the whole issue about coming back to school, if that's the case, hopefully we'll be able to deal with this in the spring as well.
Definitely. Thank you all for those wonderful points and emphasizing how important leadership was and currently still is in transitioning faculty, staff, administrators, students to a different way of learning. So I believe Dr. Bowen and Dr. Jeffries L already started talking about our next question a little bit, but I want to go ahead and ask you all, how significant are collaborations between leadership, administrators, and faculty in addressing pandemic-related changes to the academic landscape? Dr. Jeffries L.
As I alluded to, I think that this is very important because time is an enemy in all this. We need to make decisions, and we need to get information, and we need to have it rapidly. And so, it's there. A lot of schools already have good alliances, and in different regions. In Massachusetts, the Boston area is home to more colleges and universities than anywhere in the entire U.S. And so, figuring out what works, because we're serving the same populations. The communities are in close proximity to each other, and so sharing information and best practices has certainly been critical, as is sharing resources. For example, Boston University has significant resources in terms of its medical center and its own expertise, and we've been running our own testing on our campuses, as several other campuses have. But then for people who are at smaller institutions that don't have that ability, they're looking to, pricing out scenarios that involve hospitals or medical centers and things that may have been pricier, to be able to partner with larger institutions to say, hey, you guys are testing, your 5,000 students. Could you test our 1,000 along? Could we pay you and you test our people too? And so sharing information, sharing resources, this is definitely very helpful. And even outside of formal arrangements, I see cohorts of faculty by division, formalizing online learning communities to also share good practices. Things that work well in one discipline don't necessarily translate broadly. So it's nice to have some field specific expertise as well to help things out. My background is in chemistry, and there's a huge community of people who are trying to survive teaching chemistry online. And it's definitely been an enterprise for people who aren't experienced in it, but there's a huge percentage of faculty nationwide who have been doing this all along based on their institutions. And so, sharing information has just been so critical.
No, thank you. Dr. Bowen, what are your thoughts?
Again, I think it's so important. We had such high stress levels among our faculty, and I think one of the difficult things, it's sort of settled down now, is that at the beginning of the pandemic, information.
Oh no.
I think she may have froze a bit. So I'll go ahead and go to Dr. Hargrove while we wait for Dr. Bowen to return.
Oh,
Here she is.
I'm not sure. Am I back?
Yes.
Yeah.
Sorry about that. So I was saying that at the beginning of the pandemic, information was changing rapidly. And so, it was a tough decision. Some of the leadership was saying, well, it's changing too fast. We're going to get all of the information together and then give it to faculty. So, there was a perception that you're keeping something from us. We're not getting information quickly enough. So then you transition to, okay, we're going to give you daily updates. Well, what do you mean? What was right yesterday is not right today. So I think people have, even the students, and it's very unsettling, but we finally in the flow of things and have a way of communicating, and also with communicating with the students. We had to put a lot of systems in place that we didn't have before. We didn't need COVID trackers before, who was going to find out if we had students who got sick. And we're a nursing program, so our students are in hospitals. They're in clinic settings. So it's really important for us to keep up with where they are and if they're ill or not. And so it's been difficult, but we've been very innovative at the same time. We looked to other programs on campus. What were they doing to keep up with their students? So we developed, protocol for daily self-monitoring. It was a mess in the beginning because people weren't completing it, uploading it, and now it's one of these QRT things. It comes to their phone, they do 3 or 4 checks. If they have any symptoms, people are notified right away, and they can take that student out of circulation, if you will. Just like Dr. Jeffrey Zell's program, we're in applied science. So, chemistry, I know that I had to take chemistry. You have to go to the lab. And so it's the same thing with nursing. We can do a lot of the didactic delivery of education online, but at some point we've got to bring those nurses in to lab settings so that they can practice. And then we have to get them out into the hospital so that they can begin care for patients. Now is not the time to slow up the pipeline for healthcare providers because they're needed now more than ever.
No, thank you for that. Dr. Hargrove.
Yeah, I'll be brief. I'd like to extend that question to move out of academia and pose that to industry. So as an example, our relationship with a company like Lockheed Martin recognized that this was going to have a major impact on the engineering program, or our College of Engineering. And so, through a collaboration and partnership that existed for some time, they donated a number of laptops to our college, along with several other HBCU engineering programs for our students. And you've seen that also in K-12 education. The point I'm making is the role of corporate and industry with regard to the quality of education, even in higher ed and even in K-12. Many of them stepped up, whether you're talking about software, enterprise systems, learning management systems, whether they were donated or discounted or whatever. That has helped facilitate this whole educational challenge that we've had. I think it's an opportunity to strengthen those collaborations with industry and other areas. A good example, Dr. Jeffries L. How do you simulate working on a chemistry lab, right? How do you students, fill a beaker and add chemicals and all of that? Well, right now you can only simulate that through the computer. And so companies who have generated those tools, some of them that already exist, integrating them into respective curricula. So the point I would make is the role of industry outside of academia, investing in higher ed as well as K-12 to ensure that the quality of teaching, the quality of learning is at the same level, if not better.
No, thank you. Thank you for those wonderful points. We have a couple of audience comments and questions that I wanted to point out. We have the first question from Mr. Smith, who states, with many students finding it difficult to attend school online, how will the university help them maximize their learning experience? Dr. Bowen, how would you respond to that?
We've had that situation where we have students have difficulty attending classes online, taking exams. Our exams are proctored. And so one of the things that we did was, we just encouraged students to be open with us, talk to us about what their needs were. We're in South Carolina, and so students had to go home, and some of them are out in, very rural areas where they have unstable Wi-Fi. So one of the things that we're doing, we have an LMS that allows us to record our lectures. And so we record all of our lectures so that if students get kicked off, if they are in a situation where they don't have Wi-Fi on a particular day, they can listen to the lectures and they're not missing out. We also, students didn't have spaces to study, appropriate spaces. And so one of the things that we did was we had to find a way to get them back into our building. And so we've created some spaces where we can have social distancing, students can have access to Wi-Fi, sign up times where they can sign up and come on campus to have stable Wi-Fi, because they're not even allowed to hang out in the campus area. It's like get from one building to the other. There's no lounging around. So those are some of the things that we had to do to help accommodate some students.
Okay, thank you for that. I have another question from the audience, from Ms. Johnson. Do you feel it's the same quality of education? Are the students missing something going virtual? Dr. Jeffries L., what is your thoughts?
I think it's, the answer is yes to both. I think that, there is quality there. I think faculty are doing, putting a lot of effort into trying to deliver the content that was present in their in-person classes to the extent that they are able to do online. And I think so in terms of getting the content and the material and the delivery to the students, that is happening. At the same time, what you pay for when you go to a brick and mortar school above an online education is that human experience, is that personal interaction. And so that is the part, it's really hard to balance using Zooms and trying to do meeting rooms and breakouts, but where you have, group projects and discussions, and students are still getting those types of assignments and doing those things online, but it doesn't have that same feel as when you do it in person, and that interaction with your classmates and that team building. We're still trying to give students those opportunities, but it is a different feel when everything is on a virtual platform versus kind of the organic development of interactions that happens when you get to interact with your peers in person. And so that's the regrettable part about this. And I think that's what the students are feeling as well, is that they don't have that they don't really get so much that human connection with each other's and also with the faculty as well.
Okay, thank you. I think you're muted.
Sorry about
No
that.
problem.
So if I can respond to that. So if you imagine a second grader, right? A second grader and a college student, and ask yourself what level of face to face do they need to learn something, right? And uh, here in Tennessee, it's been documented that there is a learning loss for kids from kindergarten all the way up to, I think it was like the fifth or sixth grade, even with remote and virtual learning. So that's documented. For the more mature student, whether it's high school or a college student, uh, some would say maybe, as Dr. Jeffrey Zale said, that, that learning loss may not be there. And in some cases, based on learning styles, that may be contribute to students doing well, even though, there's research says that students of color typically don't do well with virtual and remote learning. So I share both of those contexts because, for a second grader or even a first grader, they thrive on the interaction amongst the kids in their class and their learning. The rate of learning is so intense, it's just amazing. And they thrive in that type of environment, interacting with the teacher. And so imagine eliminating that, and then it's pretty much homeschool, right? Which is a whole nother topic. But the point I'm making is that, those two extremes have really become evident as a result of COVID. And us as educators in the K-12 space and higher ed, we need to make sure that the quality of learning, no matter how it's delivered, we got to be creative enough to make sure it happens.
No, thank you for you all responding to some of these comments. As you can see, our audience is very engaged, wanting to know the perspectives and intricacies of how you all have been handling the changes due to this pandemic. And just to reach out to our audience again, if you all would share this with all your colleagues, your family, your friends. This is a very wonderful conversation that we're having this evening. And I believe it, you all probably know someone that this is affecting. So to hear it from some of the expert scholars that we have on the panel is very, very important. So I again, audience, share, comment, like, and, just continue to follow us as we dive into this dialogue. So the next question that I have, and I know we talked a little bit about this briefly throughout some of the other questions, but what disparities have you witnessed as a result of the pandemic that impact specifically African American students in the academic setting? Dr. Bowen.
Some of the major disparities are, financial. Just as Dr. Jeffrey said that we have students who are there, they're on scholarship, and many of them need to work. And so in the Charleston area, most of that work is in the service sector. So when those businesses closed down, we had students who couldn't pay their bills, students who couldn't eat, and then there's also the technology divide, because we had students that were going home and they had no Wi-Fi, no connectivity in their home. So they're falling behind in their studies. And living in Charleston and being still, Charleston, some areas of Charleston are just as expensive as Brooklyn, so it's a real hardship. We don't have on-campus housing. And so, students are living there, but you're not going to class, but you can't really go home. It was very difficult for them. And I'll also say that we're seeing disparities in terms of health and health access. Now, everybody, if you're in school at our university, you have to have or show proof that you have some type of healthcare coverage. So people who may have had their own private healthcare coverage, they don't ask how good is that coverage, but, people with illnesses trying to get appointments, if they tested positive for COVID, or not if they tested positive for COVID, but if they had an exposure to COVID, How are they going to get tested? So those are processes that we didn't have, and places that they could have gone to before. Even primary care providers, they either didn't have tests or they weren't able to deliver the tests. So, we got together, we were able to figure something out with student health, that we could have a process that if students were exposed, they could go and be tested. I know other universities have random testing that goes on. We don't necessarily do that, but and mental health. Mental health has been a huge problem with our students, especially our minority students. They're not as quick to come forward and ask for assistance, and many of them are dealing with deaths due to COVID. From close families and friends. So I think all of those general disparities in terms of access to healthcare, food, and the other social factors, finances, all of those things blew up for our students.
Okay. No, thank you for that. Dr. Hargrove. I think you're on mute.
I'm sorry. I'm trying to keep out the background noise.
No problem.
I think Dr. Bowen eloquently described that, and institutions like mine, all the issues she mentioned are just even more pronounced. But probably first and foremost, the enrollment across universities. Most universities saw some decline, and that varied between 4 and 10% across all the universities in the country. And my institution also saw a decline in enrollment. But the main reason probably for that is that many of their parents were in service-related areas that certainly impacted their employment. And quite frankly, the affordability factor of coming back to college in the fall was indeed just that, a challenge. And some students have taken the so-called gap year, or take a semester or maybe even a year off before they return back to school. And so hopefully that they do return back to school. So, all the points that Dr. Bowen mentioned are very relevant. And the question is, how do we address that? So the disparities are there. The question is, how do we address that? And so, hopefully many of those parents and guardians will, and some have returned back to work. And we're going to see under this new political leadership, how does the workforce respond to COVID with regard to industries like the hotel and restaurant business, because those are key industries where at least a lot of our students, where their parents actually work, and hopefully we'll see some better news in the future.
No, thank you for those points. Dr. Jeffries L., what are your thoughts?
I think I'll echo a lot that was already stated. And, the only thing I'll add is one thing that jumped out about me was just agency, privilege, and entitlement. That where you start to see some of the differences is in how the students managed these situations. That students who were more affluent, and certainly those who were more privileged, and we can read into that white privilege, their expectations, what they asked for, demanded of faculty and administrations in certain instances, was very different than students of color. And I would often have to, remind my colleagues to say, if one student raises this concern, you really should check in with the other students to see if they have it, because often it's the students who are the most disenfranchised who take their lumps, for lack of a better word. And so when something bad happened to them, they just accepted it as another bad thing that's happening to me. Let me figure out how to manage it. I will do the best that I can do. Whereas the students of privilege would be like, no, my Wi-Fi isn't working, or I need more time for this test, or this date and time doesn't work for us. And so they were often the ones who were raising the alarm bell. But to remind faculty to say, if a student comes to you with an issue and you say, okay, I can understand that there was an internet issue, so I'm going to give you an extension on assignment, maybe you should just open up the deadline for the assignment to everybody, because one student came forward to you, but there are probably 3 others who were equally, affected by this, but didn't feel empowered to advocate for themselves. And we find that more often than not, it's a student of the colors who don't know to advocate for themselves, or don't know how to push, and and don't expect necessarily administrations to do things to help. We were fortunate that our administration at all levels was able to do a lot of things to help students. People were given wireless hotspots and things like that to help shore up different internet connection issues. And we were encouraging faculty to make sure that if you had a test, to take advantage of the feature that our system had, that you can just time the test. And so it wasn't necessarily important to say the test will start at this time and end at that time, start at 7 and end at 9, because maybe 7 to 9 doesn't work for everybody. But to say you have 2 hours from when you start this test to finish it, and to be to give more flexible deadlines, then students can figure out within a window when that opportunity would work best for them. And so I think, to me, that's where I saw the disparity, was that a lot of students of color did not know how to advocate for themselves, or didn't have the level of expectation of assistance that some of the majority students had.
Oh, thank you for that. And what I'm hearing is that there's a variety of socioeconomic factors, social factors, economic factors that came to the forefront as disparities during this pandemic within the academic setting. So I thank you all for providing such wonderful points. So in knowing that these disparities are currently present, or were present at the time of the pandemic, what resources do you believe are necessary for the educational system to deal with the institutional changes, as some of you all have mentioned, restructuring, budget deficits as a result of the pandemic? Dr. Bowen.
Well, finances are first and foremost. I mean, the schools have taken a big hit. Again, it's a business, and the students are customers. And whether they're there on scholarship, somebody's paying for them to be there. And so, we're digging in. We're having to go into reserves to be able to pay for things that we didn't have to pay for before. For example, we have secured exams that we give to students that we cannot give unless they're proctored. Well, we didn't have to worry about a proctoring cost before, because they were on campus and the faculty were trained to do that. Now you have 100 students that need to take an exam. We had to put that, we had to come up with this proctoring costs. We couldn't pass it on to the students because, there was no way, no mechanism, and there still isn't right now, to pass those costs on. So they have to come from somewhere. Definitely, I would say investments in technology and faculty development, so they can be comfortable with online teaching modalities, and exploring the andragogy of teaching online. Teaching, as Dr. Hargrove said, the way a second grader learns and the way, someone in higher ed learns, it's very different. You think about cognitive load, how much can people take? They can't sit. It's not realistic to have someone sit in front of a computer for 4 hours for a lecture, like they may have done when they were on campus. So how do you put breaks in? How do you bust this up? So there are people who do it very well. We just need to bring those resources. And I'm really happy to say that our university stepped up, and they have a whole cadre of people that kind of came around and developed mini education series. Faculty can go to, click on, and they can learn at their own pace. So those are definitely some of the things. But money, the finances are huge.
Thank you. Dr. Hargrove.
So I would, what the question is resources. So I'll go back to the role outside of academia. So there's essentially 3 external sources that could help support institutions. Obviously, that, as was mentioned, the role of corporations making investments, whether that's technology or hardware, software, whatever the case may be. I think there's a role there. Secondly, many institutions are benefited from the CARES Act And so federal funding and as well as state funding has been infused in many higher ed as well as K-12 as a support resource as well. And then third, when it comes to resources, I'm going to call out the faculty by, which was mentioned earlier, doing more with regard to the whole instructional piece. And I only say that because, we have some faculty, quite frankly, are old in their ways, and so our institution, every faculty member has undergone workshops and seminars on innovative instruction. And I don't know if COVID happened, many of them would have been forced to do that. But there's a percentage of them have made a transformation to recognize different learning styles, different approaches, what tools are out there to help with learning. And the key word is learning versus instruction. And I think that has been key in a lot of ways. And so, COVID, and if you read the Chronicle or any other publication, higher education has been disruptive in a positive way, despite the challenges that we're going through this learning period. Fall of 2021 is going to be different. And that's a good thing, but let's also hope it doesn't be in a situation where again the learning aspect, which in a lot of ways is more or less personalized learning, doesn't default with regard to students and the reason why they come to college and pursue their respective degrees.
Thank you. And just to mention, I know now a lot of professors, faculty now know how to use Zoom very well, very versed in the technological aspects. So I'll definitely say that. Dr. Jeffries L.
The only thing I'll add on to this is, on the university side, we also need to be mindful as we, dedicate resources to manage the situation, that this one blindsided us as a one-off, but we should be thinking long-term and anticipate the possibility of needing to pivot again. I mean, some people are kind of bootstrapping and doing things that aren't necessarily long-lasting, but to not be afraid to make maybe a little bit, higher price scale investment in technology, but to equip yourself both for the possibility of needing to pivot to an online learning situation in the event of another pandemic or whatever. But also, the one thing many of us have learned coming out of this is what we are capable of doing remotely in a fashion that we didn't used to, and to not lose sight of that. Some of this modality of hybrid learning models offers a degree of flexibility that did work to the benefit of students that were often the non-traditional students. So, coming from the graduate side of the house, we never did graduate education online, but now we're doing it in the hybrid mode because many of our students can't join us on campus. And, I'd hate to necessarily let that go and we get fully back onto campus, because for students who had longer commutes, for students who had families, for students who were working, non-traditional age students, the ability to actually have your graduate education, and make a decision. Okay, I want to, not fully online, because there are schools that do that and do that well. But again, sometimes when you're paying for the degree, what you want is that human interaction. But to be able to make that call to say, this is not a day I can come to campus. My kids are out of control, et cetera, and to know that the lecture is available to you online if you don't come, every day or every time. And so I think that, we should also look at what did we gain by having these online presence and not necessarily let go of that. But one of the most significant investments that many schools had to make was in the technology, and things like cameras and videos, mics and stuff were in short supply. So to definitely try to look at your classrooms and get them ready. And the second part is in training your faculty. There was a lot of self-teaching going on to actually formalize the preparation and education for people to do hybrid teaching, and online education would also be helpful.
No, thank you for that.
For our audience, I assume we have some PhD students with regard to the Black Doctoral Network, I would challenge them. If you're pursuing your PhD and you're maybe a year or so out, I hope you are also trying to learn how to provide instruction. I know you have your specialty as well, but that's a great time to try to learn how to teach, how to be a better instructor, innovative ways of delivery, remote, virtual, and in person. I hope you have an opportunity to practice that while a graduate student, while a PhD student, so you don't go in cold and blind with your newly minted PhD and you get thrust in the classes that you just got to, fight your way through. So as a PhD student, find ways to practice and innovative teaching while before you get those 3 letters at the end of your name.
Yes, I've taken heed your advice. So thank you very much for that information. And I'm sure a lot of the audience members would definitely take that into consideration because as you all have mentioned, a key word here is innovation. Nothing, I don't think we'll ever go back to the norm that we previously had. So thank you all for your wonderful points. The next question that I have, and we've really focused a lot on the institutional factors, but I want to transition to more so the external factors in regard to community and local organizations. How imperative are these external factors in providing support to the educational system during a pandemic? Dr. Jeffries L.
Being a faculty member at a very large urban campus, we definitely have had relationships and good communication with our community partners as well. Many of our students actually take public transit to school. We feared for the longest time that the most likely vector for transmission would actually be the T. And we were very happy to see that the city in Boston actually took a very serious look at transmission and proximity and density and stuff and resolved that issue to a small extent to us. Another thing I'll point to from community that's been hugely beneficial, and this is going to be true of any institution, is going to be the alumni network. And so, alums have been so helpful and so generous in donations. I mean, obviously everyone's going through things with the pandemic. Many people have lost their jobs, but some people are still working and doing well. And I've just been really touched by the number of alums who have come forward with gifts to say, are you guys doing emergency financial aid? Are you guys, have any emergency situations you need to deal with? Here's a large donation to help out your students. And it's just been, amazing sources of support. And even with alumni networks for building, we have an internship program. And a lot of the existing internships kind of went down in flames because they couldn't be done virtually. And so now we're starting to have conversations to say, does anyone else have any ideas? And to see alum come forward and say, oh, I could do a virtual intern, or we could do a virtual intern. And so to really come forward and help and find different ways to try to just support the students who are on campus. I think anyone who's graduated from an institution knows how different the experience is going to be for the current students, and is sympathetic and thinking about them and willing to help if possible.
Okay, thank you. Dr. Bowen.
Yeah, along those lines, I would say we need businesses, or not necessarily businesses, but community organizations to maybe rethink some of those policies that they have, especially in terms of providing aid for students. So we have some places where some organizations that provide food and shelter, but only to certain populations. You have to be from the town, or you have to be in the area. And so a lot of our students come from, they're out of state. And so, we just wanting people to have a little bit of grace and open up and be a little bit of flexible, with the rules and things that we have. And also being willing to open up and partner. How can our students help you meet your mission? And in doing so, help us meet our mission for educating them. And again, we're in applied science. We can't educate people online and they never touch a patient. So, we had a difficult time getting hospitals to let us back in. getting clinical agencies to let us back in. So we thought of some creative ways, how can our faculty and students help you with your mission? So our students have partnered with some of our local hospitals. They're out in the community. They're doing COVID testing where they need extra hands. So it's good. The students need the experience, and the service providers are going to benefit from it. So just, I think, thinking outside of the box, relaxing some of the rules, and just having grace.
Well, thank you. Dr. Hargrove.
Yeah, having worked in industry for a number of years for Boeing and General Electric, I still continue to champion the need for industry to invest in K-12, but also higher ed, and like to continue to do that. I made the earlier statement that one of our industry partners have, purchased a large number of laptops for our students, which is very admirable type of effort from industry. But without going into too much detail, I think more can be done. I like to see industry play a greater role in K-12 to promote STEM education. I'm on the advisory board of 4 different schools, and the main thing I always advocate is, we have one of the largest companies right here in metropolitan Nashville, Nissan. What level of investment are they making? Not to schools that probably going to do well no matter what, but schools that actually can use a greater investment than others. And so whether it's the pandemic, whether it's social unrest, whatever your cause to make an investment, let's make it happen. And hopefully many of them could be more accountable.
Yeah, thank you. So we've talked about so many different things, the psychological, social, the political aspects and economic aspects of what this pandemic has adversely impacted a lot of the different institutions within the academic setting. So I want to focus on more so the positive portions or sometimes recommendations. What are some ways that we can continue to address the changes to the academic landscape to foster better transitions during the pandemic? Dr. Bowen.
Well, I think work and continuing to build on them. And, so I think a couple of things happened for us. We found out what we did well, and we found out that we had some really big gaps in other areas. And one of those gaps was, like the technology. Our faculty were issued laptops, when they came to work, but, those laptops need to be kept up. And then I have adjunct faculty who work for me in clinical areas, but part of our clinical education now is hybrid. So faculty didn't have computers. So that's something that we're going to have to think about down the line. How do we get those resources, laptops, hotspots in so that if something goes down, you just give it to a faculty and they can keep going? Some of the ways that we were able to be innovative, switching, small group work, transitioning that from having students working together, creating, and then having to create breakout rooms and putting more faculty together in the classroom. So we have 3 faculty teaching a group of students. And when we do these virtual breakouts, we can pop in and out of the room. And so it stimulates that feel of having your faculty kind of walk the room and what are you talking about? So I would say definitely thinking about it, continuing to build on the things that we're doing well, and then working quickly to shore up the gaps, because this time it's COVID, it's going to happen again. It may be another disease, hopefully not, or it could be a natural disaster, a hurricane, an earthquake, anything that disrupts learning. And, you know, I think some of us were caught a little bit flat-footed.
Okay. Dr. Jeffries L.
I think, I think we're almost at the place now where we have to realize that, just as sure as most universities probably had an emergency evacuation plan or a fire plan, we really must think about having, an emergency, what if we have to shut down campus plan ready, and thinking about what we learned from this experience and the things we had to cobble together on the fly, what's worth keeping and what needs work and refinement, but to really kind of come up with a backup plan. I don't think most universities had a backup plan for this scenario. Maybe some probably had, in Hurricane Alley or something, may have had backup plans for if your campus got flooded out. But like was just said by Dr. Bowen, most of us got caught flat-footed. And so I think that we definitely should, look at our contingencies and keep refining and planning that in the background for the next thing that comes up. I think definitely we need to do with that. Including budgets. A lot of university budgets are kind of lean. They run year to year with very little overages or very little contingencies. But to think about, what does your budget look like if you're, for those who have an enrollment-based funding, tuition-driven budget, to think about what your budget would look like, and can you buffer the decrease in enrollment of 10%, 20%. 30%, and to think about planning around that as well as you think about your expenditures. So these are things. These are stuff. The money part of the house keeps many people up at night, I'm sure.
Definitely. Dr. Hargrove.
Yeah, absolutely. So if I can pretend that I'm a president, I would say three things. One is that as an institution, I would expand and invest in the emergency management office that's at your institution. Some institutions may not even have an emergency management, but emergency management can be expanded to be broad, as Dr. Bowen mentioned, to address whether it's weather related, but also infrastructure related as well. And so expanding that unit would be advantageous. Secondly, every institution should have some type of center for teaching and learning. Looking at different ways, research ways to improve learning at every level, whether they're doing that again for K-12 or even higher ed. What are some of the best practices, and on a regular basis, infusing that into the curriculum and training your faculty. And then third, what Dr. Jeffries L. mentioned with regard to managing costs from a president, some kind of emergency fund. Sometimes you have to, hopefully you don't have to dip into the endowment or reserve for funds on a regular basis. But having that resource is essential, where cost is an issue when it comes to a disruptive impact on the institution. So again, an investment in emergency management, a center for teaching and learning, and having reserve funds for disruptive actions is something that I think every university needs to make sure is in place.
No, thank you for those wonderful points. And we've reached the conclusion of our discussion, our conversation this evening. But I want to not only say thank you, audience, for watching, but thank these expert scholars and innovators at this juncture in how you all have been able to handle your institutions during this trying time. Your work does not go towards a blind eye. And I want to say I appreciate all that you have done and all that you all continue to do, sharing your expert knowledge and skills and the efficiency and the quality of the transitions that have happened across all levels within your institution and other institutions. I just want to say thank you. As a student myself, I experienced it. And I want to say that you all, I don't think people really understand how much went into this almost transformation of the academic setting that we have experienced. So I just want to say thank you all again for taking this time out to really share this information with all our viewers this evening. So before we go, I want to just reach out to our panelists to share some of their contact information with some of our audience members so they can be able to reach out to you all and just, continue the dialogue. Dr. Hargrove.
Yeah. So I'm at Tennessee State University. You can reach me actually through that institution or personally at my email, skhargrove@gmail.com. I do have a IG and Twitter, but you have to search for that.
Okay, thank you. Dr. Bowen.
Yeah, so thank you very much for inviting me to this conversation. I really appreciate it. I'm at the Medical University of South Carolina, the College of Nursing. You can find me if you go to musc.edu, click on College of Nursing, and my email address is bowenf@musc.edu, and I'm on Twitter at Felicia Bowen. No spaces.
Thank you. And Dr. Jeffries L.
Yes, I'll just echo. It's very nice to be part of this conversation, and thank you all for inviting me. And I enjoyed the dialogue and the questions that came up. I'm at Boston University, so I can be found at my personal webpage listed below. My home department is the chemistry department. I'm also linked off of the College of Arts and Sciences page. My email is malikaj@bu.edu. And I listed my Instagram. I'm Chem Diva. I'm also Chem Diva on Twitter. So give a sister a follow.
I'll be doing that, Jeffrey Ailes.
So thank you. Again, I cannot say a profound thank you to what you all have done and continue to do. The level of flexibility, understanding that you all have given to your students, faculty, staff is irreplaceable, to be honest. And just the way you all have been relatively understanding to a lot of your students is deeply appreciated. And I just want to say thank you for taking this time out this evening to share the insight and your expertise in how you all have been able to adapt to the challenges of the pandemic. And to our audience members, thank you all for viewing. Again, this Friday at 7 o'clock, the Black Doctoral Network weekly web series Conversation Starters. Please follow us on our website, blackphdnetwork.org, or on Facebook as well. We look forward to seeing you all next time. Thank you for watching. I'm your moderator, Fessé Longue. Thank you.
Thank you, Fessé. Appreciate it. Bye-bye.
Thank you.
You did a great job.
All right. Are we still live?